Hello. I dropped my laptop, so my keyboard isn't working. I
Oh,
wanted to say hi. Hi, Rosie.
welcome. Good afternoon.
Hi there. Sorry about that. I was in the other room for a second.
Hey, Rosie, thanks for being here.
Oh yeah, for sure. Thanks
I-
for having me.
Always. And we will got about 9 more minutes and we'll get going. So thank you all who have joined already, and we'll get started right at 2 o'clock. All right, good afternoon, everyone, and welcome to the weekly webinar. We're glad to have you all here. A few housekeeping notes. Please make sure you have yourselves on mute during our presentation, and you're welcome to use the chat button and feature if you have any comments or questions while our presenter is talking, and then I'm sure she will give us some time after she presents to answer any questions that you have. If you need closed captioning, go ahead and find the CC at the bottom of your screen and you can enable that. We are very happy to have Rosie Pasqualini here to talk to us about why sleep matters today. And we know that that's been a really hot topic lately. You all have asked lots of questions about the importance of sleep. How much should you get? What is quality sleep? And so we know Rosie is going to give us some good information about that. If you're here, not only for Rosie, but also because you read the Brain Booster this week and you noticed there was an extra question that I'm only answering today during the webinar, then I'll take you out of suspense. And that question was true or false, adults need less sleep as they age. And the official answer is false. Rosie is saying yes, so glad we got that right. The longer answer is that our sleep needs change over time for lots of reasons. Our health, our lifestyle, our environment. Rosie is the expert on that, so surely she is going to tell us some things about that. But age alone does not necessarily mean that you need more sleep. So with that said, let me tell you a little more about Rosie. She is a program assistant with our wonderful LEAP program, and Rosie helps to facilitate and improve the Alzheimer's Disease Research Center's Healthy Lifestyle courses. Rosie is passionate about leveraging technology and research together to improve health outcomes. And she's got a Bachelor of Arts in Cognitive Science and Philosophy from Beloit College. So Rosie is going to talk to us about sleep phases, sleep hygiene, and brain health. So I will turn it over to you, Rosie, and thank you again for being here.
Thank you so much. Hi, everybody. As Kelly said, I'm very excited to speak to you with even more details about sleep. You may have noticed or been present for Dr. Xiangsakan's presentation a couple weeks ago, where she spoke about different sleep myths. And we noticed that sleep was a very popular topic, and I had a sort of somewhat related sleep presentation planned, so we thought it would be potentially helpful to go ahead and have another sleep-related presentation. You might see a little bit of overlap between the presentations, but mine will focus more specifically on phases of sleep and sleep disorders and how they relate to brain health. So I hope you find this interesting. And at the end of the presentation, I will be happy to take any questions and do my best to answer them, as well as talk a little bit about the LEAP program, which is our set of free online courses offered through the KU ADRC to help improve brain health and protect brain health. And as the program assistant, I'd be glad to tell you more about that at the end. But for now, let me share my screen and let's get started talking all about sleep. All right, just a second. Can everyone see my slide? Sounds good. All right, so as I said, I will be detailing specifically what happens in specific phases of sleep and why each phase is important, as well as providing information about specific sleep disorders. So that's sort of the core of this presentation. But we will cover quite a bit of ground. So during this presentation, I will talk about sleep needs and actually different sleep types across the animal kingdom, just because it's a little bit interesting and it really emphasizes how important sleep is for almost all beings, though not all organisms technically. I'll talk about the roles of sleep in our health and especially in brain health. I'll talk about the sleep cycle. I'll talk about some common sleep disorders and problems, with the quick caveat that even though I am fairly informed about these, I'm not a doctor. So I do recommend that you speak with a healthcare professional if you think that you may have one of these sleep disorders. But I'll let you know what to look out for. And then we'll also discuss some sleep-wake hygiene and how you can improve your sleep. So sleep is essentially a universal need, at least in the animal kingdom. And sleep varies very widely between different kinds of animals. I just thought I'd share this because it's sort of fun. For example, here we have a koala, which sleeps between 22 and 24 hours a day. And it's thought that this is because koalas, as you may know, eat mainly eucalyptus leaves, which are very low in energy. And so they simply need to sleep a lot to make up for the fact that they're not getting very much energy or caloric intake compared to a lot of animals. Whereas here we have the elephant, which, despite its intelligence, which may sort of, surprise you, actually only sleeps 2 to 3 hours a day. And scientists think this may be because in order to stay safe, elephants sort of as a herd need to keep moving around a lot, often both during the day and night. But I think it's interesting to think about animal sleep just because it emphasizes it as a fairly universal need, at least in the animal kingdom. One more fun fact before we get into sleep in humans is just that even in animals that have sort of unusual sleep patterns, we still see sort of sleep or sleep-like behaviors. So you may have heard that dolphins have something called unihemispheric sleep. And this is where they sleep literally with one side or half of their brain at a time so that they can keep coming up for air. We also have a butterfly here, which experiences something called quiescence. And in certain insects, this is a period of rest where while the animal may not have some of the sort of waves that we associate with sleep, typically it experiences a period of less activity that we consider to be sleep-like. So just there's a little bit of information about sleep in the whole animal kingdom and emphasizing its importance among all or almost all species. There are many, many roles of sleep, and I'll go into depth about some of these as we proceed in the presentation. Sleep helps regulate inflammation and our immune activity. It promotes tissue repair. So during the little bit about different stages of sleep, I'll talk about exactly what stage promotes tissue repair, but that's a very important part of sleep. Another important thing related to tissue repair is that during certain stages of sleep, we relax a whole lot. And that helps with the tissue repair and to facilitate deeper rest. Sleep helps regulate our pain response. It's very important for learning and memory and emotion regulation. An interesting fact is that during sleep, our memories, some of our memories, are transferred from the hippocampus into the neocortex. These are both parts of the brain heavily involved with memory and learning, but the neocortex, which is sort of one of the outer layers of your brain, basically has more staying power in terms of memory. So the memories that are transferred there will generally last longer. In addition, sleep helps stabilize our blood pressure. We have a natural dip in blood pressure, and during sleep, that's sort of part of a larger blood pressure cycle. And so if you don't get that dip, it can, among many other factors, contribute to hypertension. Finally, sleep also helps stabilize our stress hormones, including cortisol. We cycle through cortisol throughout the day, with it actually highest when we are in our waking state, right after we wake up, but with a strong dip during sleep. I wanted to mention some effects of sleep loss, because a lot of what we know, though not all that we know about sleep, is mainly sort of was concluded based on what happens when we don't sleep. So if you have acute sleep loss, which means having no sleep for many hours, which I think most of us have experienced at least a couple times in our lifetimes, we can have effects after 24 hours that are similar to a blood alcohol content of 0.10%, such as anger and decreased alertness and cravings. This relates to the fact that sleep is important for emotion regulation, for alertness, of course, and it also helps modulate stuff like hunger. After 36 hours, we have a sharp increase in inflammation and some immune dysregulation going on. And interestingly, after 36 hours without sleep, which hopefully is rare for most of us, we experience something called microsleep, which is literally every time that you blink, you sleep a little bit. And this is your brain working hard to compensate for that loss of sleep. Finally, after 48 hours, there can be very severe consequences, such as hallucinations and psychosis. Perhaps more importantly, though not necessarily, but maybe more relevantly for most of us, chronic sleep loss is something, as opposed to acute sleep loss, that many of us experience on a very regular basis, which is basically, instead of not sleeping at all, you may be getting 5 or 6 hours of sleep regularly, as opposed to the 7, 8, or 9 that you actually need. And so unfortunately, with chronic sleep loss, we have an increased risk of cardiovascular diseases that has to do with the blood sugar and blood pressure regulation that I mentioned, an increased risk of psychiatric disorders due to the importance of sleep in mood regulation and emotion regulation. We can face immune system dysregulation, increases in hunger and cravings for foods that might not be the healthiest for our bodies, and some changes in body composition where we tend to put on more fat and less muscle, which in some, though not all cases, could contribute to other health problems. And importantly, as I'll talk about also on the next slide, sleep deprivation does contribute to Alzheimer's disease risk among, as you know, many other different factors. So it's been pretty well established that sleep disturbance is a risk factor for cognitive decline and dementia. One of the main reasons for this is that, and I think Dr. Xiangsikhan discussed this in her presentation as well, but sleep loss may impair amyloid B clearance. During sleep, we clear some of the amyloid B and other proteins and or toxins that essentially build up in our brain throughout the day and throughout our lives. And not enough sleep can cause amyloid B to build up faster. And that is, of course, related to Alzheimer's disease. In addition, I think it's important to emphasize that Alzheimer's disease and other types of dementia, have so many different lifestyle factors that contribute to them, in addition to, of course, genetic factors and simply aging. And so, for example, people who have cardiovascular conditions, often, though not always, may have a higher risk of dementia. And we know that sleep loss can be bad for our cardiovascular health, like with the blood pressure stuff that I was talking about. So the effects of sleep or sleep disturbance on dementia aren't limited to the amyloid B clearance. It has to do with the fact that sleep impacts so many aspects of our health that can then also affect our dementia risk or potentially affect progression. And so I do want to note there is some trouble with studies that look at things like this. That doesn't invalidate them, but that I thought would be important to mention, which is that there is a bidirectional relationship with sleep loss and dementia as well. Because in people who have dementia or mild cognitive impairment or are beginning to develop those things, sleep loss or trouble sleeping can be an effect of those diseases. So we want to just note that sort of initial causal relationship between sleep loss and dementia may not be as strong as people necessarily think just based on the associations, because there could be a relationship going the other way that influences those results. That said, there is strong evidence to suggest that sleep disturbance is independently a major risk factor for dementia in many cases. So now I'm going to talk a little bit about our sleep needs, our sleep cycle, and the importance of different phases of sleep. And since I know that it can be sort of frustrating to hear about the dangers of sleep deprivation when it's so common in our culture, I will talk about different ways that we can improve our sleep and really help our brain health. How much sleep do you need? Most adults need between 7.5 and 8.5 hours of sleep on average. And as was mentioned in the brain booster, and Dr. Xiangsikhan was speaking about this in her presentation, older adults do not actually need less sleep. They may experience some changes in their sleep cycle due to a variety of factors, one of which is simply aging and some of the cognitive changes that naturally happen during aging that may make it harder to sleep and may make it seem like they need less sleep, but this is actually not the case. That said, good sleep hygiene can benefit anybody and can help us all get between those 7.5 and 8.5 hours. So one sort of interesting fact, and I know I say interesting fact a lot, is that our brains actually do adapt to sleep deprivation, but this doesn't mean that it's okay to get less sleep. What this means is that your brain's natural sort of tiredness response to sleep deprivation can go down if you are sleep deprived chronically for long enough. Your brain kind of goes, well, I guess we're not getting sleep and I'll be a little bit less tired so this person can keep going with their activities. While this may seem like a positive adaptation and it can help you get through your day, the truth is that if you're already sleep deprived and you feel tired, you might be essentially supposed to be feeling even more tired than you are, but your brain is trying to adapt to this problem. And so even if you feel like you are getting enough sleep, you might want to really make sure that you're trying to get between those 7.5 and 8.5 hours, because our brains can adapt in ways that actually mask sort of our natural signs of sleep deprivation. If you have trouble sleeping, you're absolutely not alone. 35% of all adults in the US report sleeping for less than 7 hours a night on average. And another huge percentage, though I forget it right now, of people suffer with insomnia, as well as some of the sleep conditions I'll talk about. So it's a struggle for many of us, but there are things that we can do to help solve this problem. Before I talk about that, I was gonna go through a little bit of information about our different sleep phases so you can understand why each phase is important. I wanted to mention that you can't really optimize how much time you spend in each part of your sleep cycle. For example, you can't just be like, well, I want to get more REM sleep, so I'm going to do this thing. Your genetics and your age will influence how much time you spend in each cycle. But the good news is that your brain is pretty good at calibrating its needs to stay in the different cycles, or rather phases, sorry. If you are practicing good sleep hygiene and getting good sleep in general. So you don't need to worry about calibrating different phases specifically. Your brain will make up for lost time in different cycles. Also, dreams can occur during all phases of sleep, which I think is a very fun fact, and it's more of a recent discovery. You may notice that when you're starting to fall asleep, this is called light sleep, but it may not feel like sleep at all. You may sometimes have these brief flashes of unusual images or thoughts, and those are actually now recognized as dreams. So that's an example of how we can actually dream during all phases of sleep, though it's more common in rapid eye movement sleep. So during N1, this is a sort of a transitional phase between sleep and wake where you start to relax. And as I said, if you're awoken during this state, you might not even realize that you had been asleep. Your breathing is regular, your muscle tone is regular, and your brain starts producing theta waves that also happen sometimes during our waking lives. For example, if we're hypnotized, maybe a rare thing, or if we're meditating, or if we're daydreaming. So it's kind of this intermittent state between waking and sleep. This only lasts for about 1 to 5 minutes, or for about 5% of total sleep time. Then we enter deeper sleep. This is the longest stage of sleep, and our heart rate and body temperature drop during this stage. We produce these types of brainwaves called theta waves and sleep spindles, which are important for neuroplasticity and learning. And so are these K complexes. Actually, sorry, I made a brief mistake. So the theta waves are important for learning, but those do also happen during N1, as I just mentioned. It's the sleep spindles and K complexes that really play a unique role in N2 deeper sleep. And so these sleep spindles are these brief bursts of neuronal firing that may help synaptic plasticity. And K complexes, as you can see there, are some of sort of the most dramatic and distinct of all of our brain waves that help to maintain the sleep state, as well as help out with memory consolidation. This state is 25 minutes long per cycle and gets a little bit longer each time, comprising 45% of your total sleep. The next stage of sleep is called deep or slow wave sleep. this is where a lot of tissue formation and repair and immune regulation happens. So during this state, you have a strong decrease in muscle tone, pulse, and respiration rate. You have these special waves called delta waves, where they have sort of a distinctive down state and up state, and it's hypothesized that during that down state, your neurons are actually getting to relax in a way that they don't typically get to during your normal waking life. So it's thought that this state, sort of along with that tissue formation, is really important for rest. Interestingly, and though and sort of ironically, this stage is also associated with sleepwalking and night terrors, especially in younger children. It's very, very difficult to awaken from. And for some people, even very loud noises, like louder than 100 decibels, which is like a motorcycle right outside your house, for example, will not wake them up. So during this stage, we specifically for that tissue repair points, build bone and muscle. And I think it's just kind of cool and impressive that we have this main state or phase dedicated to this, this formation and repair of our tissues. So then our final state is REM, which you may be familiar with. In this state, our brainwaves are very similar to when we're awake. Our body is totally relaxed besides our eyes and breathing muscles. This state is associated with dreaming. It's associated with creativity and problem solving. And as you may know, not all learning happens while we are conscious. So it's been thought that especially during REM sleep, some of this rapid fire connection in our brain is actually producing new relationships between information that we've been taking in over the past day or week, etc. So if you ever have an insight about a particular problem during sleep, it might actually be related, or sorry, not during sleep, but once you've awoken in the morning, it might be related to the REM state specifically. All right, I hope that you found that sort of summary of those different phases of sleep to be interesting. I will now, oh, I forgot I had a little short video that you might enjoy. This is just a demonstration of ostriches going through different stages of sleep that I thought was sort of cute and neat. Here you can see them alternating between slow wave steep sleep and REM sleep. And in the REM stage, you can see them sort of wiggling around. So they don't have that full lack of sort of muscle tone that we do, but you can see that they may be dreaming in that REM state. Now I'm going to briefly go over some sleep issues and disorders. And again, if you do suspect you have a sleep issue or disorder, it's important to talk to your doctor, even for the more minor ones that I will mention. That said, I think it's important to be aware of these. Let's go. Snoring, contrary to what you might think, does actually count as not a disorder, but a sleep problem. While those of us who snore know that it can be very disruptive, you might also think that because it's so common, it's not sort of a real problem, but it can be a real issue for some people. So I just wanted to give a brief overview. When you snore, it is specifically because your airflow is very mildly restricted during your sleep, which causes tissues to bump up against each other and create that snoring sound. So there are a number of causes, including alcohol, your anatomy, having an allergy or a cold, of course. Age increases snoring risk due to decreased muscle tone, and being overweight or obese in some, but not all cases, can increase the risk of snoring because it adds extra pressure to your airways. So for minor snoring, usually avoiding alcohol, maintaining a healthy weight, changing positioning, and in very rare cases or rarer cases, surgery for severe snoring can help alleviate this problem. Insomnia is also very common. I can't go super deeply into this topic because it has many different causes, but even though it is very common, it's something that's very good to speak with your doctor about. It's usually described as either trouble falling asleep and or staying asleep. So sleep latency, the time that it takes to fall asleep. If it's a very long time, say 30 minutes, that could be indicative of insomnia. Although, as Dr. Shengzikhan also mentioned, some sleep latency, I believe of like 8 or 10 minutes is actually normal and means that you're not sleep deprived. But if you really have trouble falling asleep, that is insomnia, as well as staying asleep. So some folks with insomnia may be awakening far earlier than they would like to, or very early in their sleep cycle. So there are many causes that can be environmental. That's a big one. So even just sleeping with some lights around you, for example, in sensitive people, could lead to insomnia. Frequent changes in routine. So if you're not going to sleep and waking up around similar times can cause insomnia. Stress, psychiatric disorders, and not enough physical activity. So exercise is a sort of a major brain health tool in many ways that can also contribute to better sleep and can help prevent these sorts of sleep conditions in some cases. So some of the main sort of more simple or immediate treatments for insomnia include a regular schedule, limiting caffeine. Caffeine has a 10-hour half-life, so you actually want to stop drinking it around noon if it's affecting your sleep at all. Having a quiet and dark environment. As well as a sort of cooler environment is important. In general, cooler sleeping environments can help promote better sleep. And finally, for short-term use, over-the-counter sleep aids can be good, though they are not recommended in the long term. You may also be familiar with sleep apnea, which is a group of conditions that basically strongly limit or completely prevent, for brief periods of time, airflow during sleep. So this is also a fairly common condition. If you have sleep apnea, you may be very tired during the day, you may gasp for air during sleep, and you may have a morning headache or dry mouth. Importantly, symptoms of sleep apnea are often first noticed by a family member. So if you notice your family member or loved one sort of waking with a start during the night or making a sharp breathing sound, you may want to mention that to them, and maybe they should get checked out for a type of sleep apnea. Just briefly, there are two different types of sleep apnea that I think it's important to be aware of. By far, the most common one is obstructive sleep apnea, in which the airway closes partially or all the way during sleep. There is also such thing as central sleep apnea, where the brain itself is not properly signaling your airway to, or sorry, your body to breathe. And so this is less common, but it can be associated with conditions such as stroke and congestive heart failure. Both of these conditions are often treated using a CPAP machine, and in rare cases, especially for central sleep apnea, your doctor may prescribe an implant that actually stimulates your diaphragm to breathe. So that's just a brief summary of a variety of sleep conditions, so you're aware of them, or maybe more aware of them than you were. Remember that many people do struggle with these, and they can be very frustrating, but there are a wide variety of treatments for all of these conditions. So I recommend that you speak with your doctor if you think you or a loved one is struggling with a sleep condition. All right, now let's get into, and I know I'm a little low on time here, but let's get into discussing our sleep-wake hygiene. So something that is important to know is that a major goal of improving our sleep health has to do with regulating our circadian rhythm. And this is something that I actually learned fairly recently. There is a distinct difference between what we call the circadian rhythm and the sleep-wake cycle. And so the circadian rhythm is a specific set of biological cycles that happen in our body approximately every 24 hours and can influence each other. One of those being our sleep-wake cycle, which has to do specifically with alertness and tiredness. However, many of these are closely linked together and influence each other very directly. So, for example, the circadian rhythm involves hormone release, such as melatonin, which makes you tired, cortisol, which promotes alertness, and I think is related to hunger, though I'd actually need to check on that, and is also related to stress. Body temperature is something controlled by the circadian rhythm and something that fluctuates during sleep, so related to alertness and tiredness as well. Hunger and digestion, alertness and mood are all controlled or at least related to the circadian rhythm. So sort of one of the main takeaways in just thinking about all these factors is that our body systems work very closely together. And so a wide variety of healthy habits can help promote good sleep, not just habits that you would think would be traditionally associated with sleep hygiene. So for example, by not eating a very large meal within a couple hours of bedtime, that helps our bodies wind down, not just because, for example, laying down after a big meal can cause indigestion, but also because eating that late can stimulate alertness due to the relationship of our hunger circadian rhythm to our sleep-wake cycle. Just briefly, you may be interested to know that there are other body clocks, such as the infradian cycle, which is a term in chronobiology that's sometimes used to describe menstrual cycles, and the ultradian cycle, which is a cycle that is 90 to 120 minutes long and has to do with our focus and alertness in sort of shorter bursts than our general sleep-wake cycle. So I think all that stuff is very interesting to think about. So some ways to improve our sleep health that are related to our sleep-wake cycle and our general circadian health is having consistent sleep and wake times. You may have heard this a whole lot, but it actually is a very, very important if you're struggling to sleep, to try and go to sleep and wake up at the same time or as close to the same time as possible, even if it's, for example, a weekend. Another thing that can help is having a bedtime or a morning routine, preferably both. Bedtime routines help to signal to our brain that it's going to be time to sleep soon. And especially if you incorporate some relaxation into your routine, it can really make a big difference in your sleep quality. This may not be necessarily as obvious or popular, though I have the morning routine, but having a sort of short morning routine can have the opposite effect, getting you ready for your day and ready to go. And incorporating natural light exposure within 30 minutes of waking, perhaps as part of your morning routine, you just step outside for a bit, can make a big difference in your alertness and sleepiness. Sort of conversely, by limiting our blue and bright light exposure in the later afternoon and evening, we help tell our brains that it's time to sleep. As you may have heard, blue light especially and bright lights inhibit melatonin production, which is one of the key sleep hormones. So we want to avoid, for example, scrolling on our phones an hour before we go to sleep. As I mentioned, it can make a big difference if you really make an effort to keep your sleeping environment quiet and dark and cool. Your brain continues to process stimuli during sleep. So lights, sounds, just because you're not waking up or don't remember waking up doesn't mean that they're not affecting you. And studies have sort of shown that, having our eyelids closed, because eyelids are quite thin, obviously, does not inhibit our perception of light. So we consider to continue to perceive sometimes even weak lights in our environment after we've fallen asleep. So it's important, sort of if and when possible, to sleep in a dark place, to sort of make sure there's not too much environmental noise. And if you can't do those things because of the circumstances, we do recommend earplugs, and a sleeping mask tend to work well for many people. Relatedly, as I said, avoiding large meals close to bedtime is important because having that large meal, in addition to inducing stuff like reflux when you lay down for some people, can increase alertness, and we don't want that when we're about to go to sleep. This is a little more controversial, but we do also generally recommend having breakfast within an hour of waking up. Though the research is somewhat mixed, there is fairly good evidence that doing this really helps kickstart your digestion and relatedly your the alert part of your sleep-wake cycle, because they're also related to each other. Caffeine, as I mentioned, has that 10-hour half-life. So if you're affected by caffeine sort of into the night at all, it's good to err on the side of caution and to limit caffeine up to 10 hours before you go to sleep. If that seems extreme, it's totally okay to simply cut back a few hours before you go to sleep and see if that makes a difference. As I believe Dr. Xiansukan also mentioned in her presentation, while alcohol is a sedative, it is a myth that it helps you stay asleep. it may help you fall asleep, but after drinking alcohol, you're actually more likely to wake in the night than if you hadn't. So overall, drinking alcohol is not sort of a good remedy to sleep better. Finally, we do consider it very important to learn and practice relaxation techniques. And I know this can be frustrating for some people, including me, since I'm kind of a go, go, go person. But I found that in my life, these really do make a big difference. So things like visualization, imagining yourself being in a very relaxing place, meditation, focusing on your breath, or slowly sort of observing your thoughts without judgment and letting them float by can make a big difference. Progressive muscle relaxation is another thing that we recommend. And the way that you perform progressive muscle relaxation is, for example, you could start at your feet. You clench just your feet and then relax, and then kind of go up. You can do, the bottom half of your legs, then your thighs, continuing to go up through the whole body until you sort of clenched and relaxed your entire body, which can induce strong feelings of relaxation. But the most important thing with these relaxation techniques is that you try them out and see what works for you. So you don't necessarily need to do mindfulness or that progressive relaxation. Simply reading a book, another thing that I love to do, can be very helpful to get you in a sleepy mindset. So I think I may have gone over time there by a little bit, so sorry about that. But that was the presentation. I talked a bit about the importance of sleep and brain health, how it's associated with dementia. We talked about phases of sleep. We talked about the circadian rhythm, and we talked about some sleep disorders. I hope you found this helpful. And before I take some questions, I just wanted to briefly mention, as a member of the LEAP team, that if you would like to learn more about sleep and lots of other lifestyle factors that contribute to brain health, we are continuing to enroll for our 6-week free brain health bootcamp. This is an online course where we cover different lifestyle strategies that can help improve and protect brain health. And each week covers a different sort of lifestyle domain. So we talk about nutrition, we talk about sleep, we talk about physical activity, and several other things that you may find interesting and useful. It's open to anyone who wants to improve their brain health. And it actually started on May 2nd, but you're totally welcome to still join. We would send you a recording of the first Zoom session, and then you could go ahead and attend our subsequent Zoom sessions that are at 10 a.m. Central Time on Tuesdays. So our next session will be at 10 a.m. Next Tuesday. And I put a link in the chat if you'd like to sign up. Last but not least, we offer a specialized Mediterranean diet course. It has a somewhat similar format to the Brain Health Bootcamp, but it's a little shorter. It's 4 weeks long and is centered on brain healthy eating. So the Mediterranean diet is one of the eating patterns that is most strongly associated with brain health and actually just good health in general. And so each week we talk about a different key principle of the Mediterranean diet. We also provide recipes, cheat sheets, and additional resources, and those live Zoom classes for this course will be at 10 a.m. on Thursdays, and this begins June 22nd. Anyway, I know that was a lot of information. I hope you found it helpful, and I would be happy to do my best to answer some questions. Thank you very much.
Thank you so much, Rosie. There is a question in the chat that asks, are 15 to 20-minute naps during the day additive to total daily sleep?
That is a, sorry, I need to think about that for a second and stop my screen share. So in general, short naps don't tend to affect our sleep a whole lot one way or another. We're generally more, when we talk about sort of the risks of naps, which I know isn't quite what you're asking about, but is an important topic as well. Longer naps, especially those that start to get into like stage 3 of sleep, which would be say 30-minute naps, can begin to interfere with our sleep quality at night. But I would say that 15 to 20-minute naps both will not really add on to your sleep need at night, but will also they will also sort of not be harmful to your sleep unless you're having them very late during the day. So as far as I know, those shorter naps are good for a cognitive boost. And if they're not making you have trouble sleeping at night, they are totally fine and can be good for you. I hope that that answered your question.
Excellent. And then there's another one, Rosie, about whether cognitive changes affect sleep need or sleepiness, and wondering maybe the sleeping in late is the result of night restlessness.
Right. Yeah, that's a good question. So unfortunately, I am not super informed about how specific cognitive changes in different types of dementia affect sleepiness. I don't think that they affect total sleep need, but I know that cognitive changes can make it harder for you to sort of get enough of all the phases of sleep, as well as to stay asleep for the amount of time that you need. So that could then indirectly affect perceived sleep need, because the person may need to be in bed longer to get all of that sleep that is necessary. And I definitely think that that sleeping in late could be a result of that night restlessness. So that was my attempt. I hope that sort of answered your question. I'm not an expert on the specific cognitive changes, unfortunately.
Connie has a question we all want to know, and that is,
time to drink
a
a glass of wine. I think this would depend a lot on, so for example, I'm a little biased because I have GERD, so I have really bad reflux. So for me, I really can't drink wine. I mean, I still do occasionally, but like in the evening, unless I want to just like stay up for several hours due to the discomfort. But I would say in general, maybe later afternoon, perhaps after work, but before dinner, or maybe closer to dinner, but not interfering with sort of the hours before sleep, would be a good time to drink some wine. I hope that that helps. I think it is very personal. So if wine is causing you to wake up during the night, for example, or giving you bad indigestion when you're going to sleep, that would be a time to change your wine drinking time. Hope that helped.
Cool. All right. Renee Price, I see your hand up.
I wanted to ask about the LEAP classes. My father is my loved one with Alzheimer's. I don't have any symptoms that I know of or anyone's told me about. So are those classes for me, for him, for like who signs up for those classes?
We have a wide variety of people who sign up. Sometimes we have, for example, patients or people who have dementia who will take a course with their caregiver or loved one or friend. We have people with dementia who may take it by themselves. We have people who have mild cognitive impairment who participate. And we have people who have normal cognition, who are just interested in brain health, or who may be caregivers who take it by themselves as well. So it's for anyone interested in brain health.
Fabulous. Thank you.
You're welcome.
Wonderful. Well, Rosie, thank you so much again for sharing all of your expertise about sleep and about brain health. And if anybody's watching who hasn't signed up for one of the LEAP classes, now is the time. You can get in on the boot camp that just started last Tuesday, and we'll have more information about those upcoming classes on our website and in our My Alliance newsletter. Next week's topic, our presenter is Dr. Erin Blocker from Emporia State University, just down the road from us a little bit. And she is a professor in health, physical education, and recreation. So I believe she will bring us some information about those things as they relate to brain health. We'll get the title of her presentation in time for the next My Alliance newsletter, which will come out on Monday. So stay tuned. And you also should have seen in the newsletter that we are looking for folks to participate in a siesta study on sleep. So if you are between 60 and 85 with normal cognition and some sleep stuff going on, that study might be the one for you. And you can read about it in your My Alliance email, visit our website to get the details about how to participate. And we are going to stop for now. And thank you again for being here. We'll see you next Thursday with Dr. Blocker, and watch your My Alliance for next week's news. Thank you, everyone. And thank you, Rosie.
Thanks, everybody.
Bye.